Assalamu alaikum. I am Dr. Leera, Assistant Professor of Biochemistry, Bashundhara Ad-din Medical College. Today, we are going to learn about acid-base disorder. To know about acid-base disorder, first of all, we should know what is pH. pH is the negative logarithm of hydrogen ion concentration of a solution to the base 10, where hydrogen ion concentration is expressed in mole per liter. Our normal body pH is 7.35 to 7.45. What is acidosis? When the normal body pH decreases from the normal range is known as acidosis. That means, when body pH is less than 7.35, we call it acidosis. What is alkalosis? When normal body pH increases from the normal range, it is alkalosis. That means, when body pH is more than 7.45, we called it alkalosis. From Henderson-Hasselbalch equation, we comes to know that pH is directly proportionate to the bicarbonate ion concentration and indirectly proportionate to the partial pressure of carbon dioxide. So, that means, when bicarbonate ion increase, it increase the pH of a solution. So, it causes alkalosis. When bicarbonate ion decrease, it decreases the pH and causes acidosis. Partial pressure of carbon dioxide represent the carbonic acid. So, when partial pressure of carbon dioxide increases, it decreases the pH and causes acidosis, and when partial pressure of carbon dioxide decreases, it increases the pH and causes alkalosis. Classification of acid-base disorder: simple acid-base disorder and complex acid-base disorder. Simple acid-base disorder means there is a change in only one component. That means, either in the bicarbonate ion or the partial pressure of carbon dioxide. It can be classified into metabolic acid-base disorder and respiratory acid-base disorder. Metabolic acid-base disorder is of two types: metabolic acidosis and metabolic alkalosis. Respiratory acid-base disorder is further classified into respiratory acidosis and respiratory alkalosis. When the bicarbonate ion concentration decreases, we called it metabolic acidosis. When the bicarbonate ion concentration increase, we called it metabolic alkalosis. When the partial pressure of carbon dioxide increases and change the pH, we called it respiratory acidosis, and when the partial pressure of carbon dioxide decreases and change the pH, we called it respiratory alkalosis. Complex acid-base disorder, it happens due to variation of both component, abnormality of both bicarbonate and partial pressure of carbon dioxide simultaneously. It can be classified into double phase type and triple phase type. Double phase type, metabolic acidosis and respiratory acidosis. It can be also metabolic alkalosis and respiratory alkalosis. Metabolic acidosis, respiratory alkalosis, metabolic alkalosis with respiratory acidosis. Triple phase type, metabolic acidosis, metabolic alkalosis and respiratory acidosis. Another type can be metabolic acidosis, metabolic alkalosis with respiratory alkalosis, but quadruple phase is not possible because respiratory acidosis and respiratory alkalosis cannot coexist. Primary event: initiating process of acid-base disorder which alter pH either by altering concentration of bicarbonate or partial pressure of carbon dioxide by buffering. Secondary event or compensation: compensatory process that follows primary event. Compensation means maintenance of pH level in near normal range either by respiratory system or by renal system. Correction: although at the end of compensation pH become near normal, but plasma bicarbonate concentration remain grossly abnormal, which continues to persist. So, we correct it by renal system. It is done appropriate treatment of primary cause. Correction is done by the treatment of primary cause. Metabolic acid-base disorder is compensated by respiratory system and corrected by renal system. respiratory acid base disorder is compensated by renal system and also corrected by the renal system. Acid base disorder. Metabolic acidosis. The primary defect of metabolic acidosis is decrease the bicarbonate ion. So, decreased bicarbonate ion tends to decrease the pH. How will we get compensated? By decreasing the partial pressure of carbon dioxide. And how can we decrease the partial pressure of carbon dioxide? We can decrease the partial pressure of carbon dioxide by hyperventilation. How can we correct it? By renal system. Metabolic alkalosis. Metabolic alkalosis, the primary defect of metabolic alkalosis is increase of bicarbonate ion. The increased bicarbonate ion tends to increase the pH. To maintain the pH in normal range, we have to increase the partial pressure of carbon dioxide. This is the compensation. How can we increase the partial pressure of carbon dioxide? By hypoventilation. And the correction of metabolic alkalosis is done by kidney or renal system. Respiratory acidosis. The partial pressure of carbon dioxide increases, which tends to decrease the pH. How can we compensate it? By regeneration of bicarbonate ion, and correction is done by the kidney. Respiratory alkalosis. When partial pressure of carbon dioxide decreases and it causes increase of the pH, we call it respiratory alkalosis. How can we compensate it? We compensate it by decrease the bicarbonate ion concentration by renal bicarbonate ion excretion, and correction is done by the renal system. Diagnostic approach of acid base disorder. How can we diagnose a case of acid base disorder? First of all, we can assess the clinical sign symptoms. Then we can do some laboratory investigation. What can we see? We can measure the pH, the bicarbonate ion concentration, the partial pressure of carbon dioxide, the anion gap and the serum electrolyte. The normal range of pH is 7.35 to 7.45. The normal range of bicarbonate ion is 22 to 28 millimole per liter. The partial pressure of carbon dioxide is 40 millimeter of mercury. The normal range of anion gap is 22 plus minus 4 milliequivalent per liter. Normal serum electrolyte potassium level is 3.5 to 5 millimole per liter. So, any abnormalities of this can suggest us for acid base disorder. Analysis of laboratory data, any change of pH, bicarbonate and partial pressure of carbon dioxide definitely indicates acid base disorder. Change in serum potassium level suspicious of acid base disorder, and change in anion gap suggestive of acid base disorder. What is plasma anion gap? This concept comes from a law of electrical neutrality. All the body fluid compartments are electrically neutral. That means cation is equal to anion. So, in plasma, serum cation is equal to serum anion. Definition of anion gap is the difference between unmeasured anion and unmeasured cations is known as anion gap, but practically we measured it is the difference between measured cation and measured anion. So, plasma anion gap is the difference between measured cation and measured anion. From calculation we can know the plasma anion gap is 12 plus minus 4 milliequivalent per liter. Electrolyte profile. Commonly measurement of serum electrolytes includes serum sodium ion, potassium ion, chloride, bicarbonate are termed as electrolyte profile. In electrolyte profile, the cations normally measured are sodium and potassium, and anions are chloride and bicarbonate. These electrolytes also used for measuring the anion gap. That is why these electrolytes are very important and also known as electrolyte profile. The importance of anion gap for differential diagnosis of metabolic acidosis. To categorize metabolic acidosis into increased anion gap metabolic acidosis, the causes of increased anion gap metabolic acidosis is diabetic ketoacidosis, lactic acidosis, alcoholic ketoacidosis, renal failure, starvation. Normal anion gap metabolic acidosis, the causes are diarrhea, intestinal fistula and renal tubular acidosis. Number 2, for detection of acid base disorder even in normal pH. Thank you.